Good morning, health professions. This is Mrs. Bretzker. We're just going to record a short video on the heart, okay? For my cyber students, I would like to just have something here for you to see visually because we were actually dissecting pig hearts this past week. So to start out, I'll just describe our dissection kit. What we have here is just stainless steel. These are dissection scissors that you actually can cut away a bit of tissue with. They're kind of sharp, okay? And that's how we actually expose the heart the best. This is a little blade for intricate detail work. These are Kelly clamp that you can actually hold open some structures with. And these are the forceps that we will be using, okay? So to start out, I have 3 pig hearts. You can see that they're different sizes because each pig is a different size and the size of their heart would be a different size as well. So to start out here, I'm going to look at this little sample because this is a very nice sample that we can use. I'll move this one over, okay? So this is a pig heart. If you look, you have to decide whether it's anterior or posterior part of the heart. So as we all know, the left ventricle is the one chamber that is the most clearly defined and easily identifiable. It's the largest, so this being the left ventricle is easy to identify. Obviously this would be your right ventricle. Now your top chambers are called your atria. So you would think that the atria and the ventricles would be very easily defined and they would be very obvious, yet the atria are very small and they almost look like floppy dog ears. Okay? So you have the top 2 chambers, which are the atria, and the bottom 2, which are the ventricles. Before we begin, I want to take notice the outside structure. You can see some fatty tissue right here, and you also can see a little road map of vessels. These are known as your coronary arteries, very clearly defined. Your myocardium is a very, very strong muscle and it requires nutrients and oxygen just like the rest of our body and every other organ. Flipping it over posteriorly, you can also see the coronary arteries as well. Okay? Now, the vessels. How do you decipher what the vessels are? Well, we learned the blood flow of the heart and we know that the top chamber, the atria, the right atria, is going to be fed by the superior and inferior vena cava. So we have to look for a vessel that will lead us into the right atria. This one is a bit shredded from being butchered, but yet nonetheless you can see that this vessel leads into the right atria. Okay? From the right atria, it's going to be going into the right ventricle, okay, and you can see that I'm pushing up on the right ventricle. So in between the atria and the ventricle, of course, you know it's going from the superior vena cava to the right atria through the tricuspid into the right ventricle. From the right ventricle, it is still deoxygenated. It is going to have to go to the lungs. From the ventricle, it's going to need to go out to the pulmonary artery. Remembering, of course, arteries carry oxygenated blood, veins carry deoxygenated blood, except for the one exception of the heart. So the right ventricle, you're going to have the pulmonary artery taking the blood out, bringing it to the lungs. And we can test that by putting our forceps in, and it should be leading us to the right ventricle. Okay? So the right ventricle is bringing it out the pulmonary artery, it's going to the lungs, it's going to get reoxygenated, and it's coming its way back, and we're going to be looking for the pulmonary vein to bring the blood back into the left atria. So this is your pulmonary vein bringing oxygenated blood back to the heart through the left atria, then through the bicuspid valve into the left ventricle, and the left ventricle will pump the blood out the aorta to the body. So let's see if we can locate that aorta, which we can, because here it is, leading into the left ventricle. Okay. Another example here that we have, just to show you different sizes. Another pig heart, you can see the top two chambers, the atria, right ventricle, left ventricle, okay, posteriorly as well. You can see the back of the atria, the back of the ventricles. This one has a lot more fatty tissue, but you can see clearly defined the coronary arteries as well. And here, again, let's see where this is leading. Let's look for our aorta. Again, here's my forceps here at the left ventricle, bringing the blood all the way out to the heart. Now, let's put these to the side and get rid of this icky mess. And this heart as well, same structure on the outside, but we cut it in half. Let me show you the inside. You can see the myocardium, how thick the muscle wall is itself, because the heart has to pump very, very far, all the way down to your tippy toes as well. So we actually dissected this major vessel. Looking over here, you can see I want to show you some chordae tendineae, and we're going to look for some valves. Here's a valve. They're very delicate, and the chordae tendineae, as shown in one of your diagrams, is the connective tissue that actually holds the valve in place. And over here, this is the right ventricle, okay? This would be the left ventricle. This is the anterior side. Okay. Now, just to give you a feel for what we've been doing, just to show you an idea of the heart. I'm going to be trying to save a couple of hearts in Frozen for hopefully when we can get back together and my cyber kids can return to give you the opportunity to dissect a couple hearts. But that's basically the anatomy of the heart.